Welcome to another episode of Dental Talk 360. Today we're going to be delving into the fascinating world of facial aesthetics. And today we have a guest speaker, a facial plastic surgeon, Dr. Miguel Mascaro. And he is going to be discussing with us how facial aesthetics can work in synergistic effects with cosmetic dentistry to create harmonious and beautiful results for patients. So Dr. Miguel, if you don't mind.
Please.
What led you to specialize in facial cosmetic surgery?
I think everybody has an interesting road that they get into before they kind of figure out what it is that they want to do, you know? And for me, I started with the reconstructive route, right? I always wanted to do reconstructive in some sort of way. And, you know, to make a long story short, my program was very heavy in reconstruction. We did a lot of trauma work. We did a lot of free flap for cancer reconstruction. I thought I wanted to be a skull base surgeon, taking tumors from the skull base and doing big reconstructions. I did one of them. I walked out and I said, I'm not doing this. Like, this is just not the life for me. And at that point, you're already invested, right? You know you kind of like this stuff. You know you kind of dig it. And for whatever reason, there's just certain things that you don't like about it. And so you got to figure out, what is it about what you do that you like, and kind of focus in on that. And I remember scrubbing into a rhinoplasty. And I thought it was the coolest thing I've ever seen in my life. And the thing about that I thought that was fascinating, and you guys may find this somewhat similar too, was the detail work. You know, there was so much attention that was paid to the minutia, where it was like, okay, how's the light gonna hit this? How's it looking? Where's the shadow? If I take a little bit off the super tip, the area right above the nose, what does that do to the dome and how the highlights point in? So in my mind, immediately, I started to think, I really like this aspect of the surgery itself. And then I started kind of looking at other aspects of cosmetic surgery and what is it we do. And I loved facial. And then I just kind of dove headfirst into it.
Wow, that's beautiful. I know that dentistry is very comparable in many ways because we talk about facial thirds a lot in dentistry. How has that conversation impacted your training and the way that you now view patients and also potentially work with cosmetic dentists?
It's incredibly important. It's incredibly important. And I think that particularly for what I do, the conversations that I have with my patients, we always discuss the importance of the facial skeleton, right? You guys deal with this primarily, whereas when people come, they sit in the chair in front of me and they start talking about volume loss, or they start talking about elasticity issues or laxity issues. They don't think about the fact that their bone's been resorbing for the last couple years, and the facial skeleton that they have now is different than the facial skeleton on that picture that they're showing me from 10 years ago. And so it's super important. And at least in my practice, in the way that I did my training, the teeth were super important, because when you start losing teeth, as you guys know, that resorption around the mandible and the maxilla starts happening so fast.
And even with teeth height, right? So if they lose vertical dimension, they start getting different angulations within their nasolabial folds.
Yeah, and you know, yeah, absolutely. And I'm, before we get too far into the weeds here, you know, I do a ton of lips. I do more lip surgery than just about anybody in the world, really. I do around 500 lip surgeries a year.
Wow.
And so when people come and talk to me about the issues that they're having with their lips, guess what? If they've got an open bite, or if they've got malocclusion issues with a little bit of an overjet, or if their palate is narrow, you don't fix that, it doesn't matter what I do with the soft tissue, it's not gonna come out with the result they want. And more often than not, if you just fix the teeth, their lips look pretty good. You know, that proportion ends up being fine. The smile ends up being what they always shot for and what they wanted. They don't have that strain when they're lifting their lip and exaggerating the expression. So the two work hand in hand. And more often than not, I find the patients that are unhappy are the ones that prioritize one over the other. And unfortunately for you guys, most of the time they prioritize the soft tissue, and they don't realize the importance of what's hiding behind. They don't realize the importance of what happens with the window, and they're just focusing on the curtain. And that's kind of how I like to explain it to a lot.
True. That's a great way to explain that, because even when in teeth, you could increase a little bit of the cervical bulge of the top of the teeth, which would put the position of the lip higher when they're smiling, or drop it down. We all do that with cosmetics in our planning. That's why I love when you talk about the minutia of things, right? Looking at line angles, looking at zones of reflection, which you're looking at in plastics. So it's incredible to have you here to have this discussion, because it does relate to each other. I had a case, patient fell, had a bike accident, fractured all her front teeth, and then needed to have labial surgery, and waited until I was done with my veneer work, and then had her lip surgery, which is, it helped a lot. And I remember her telling me, my plastic surgeon wants to wait until you're done, so that then he could do my surgery, so he could position it in the best place.
Well, I remember the way that I got to know these guys at APA was I had a case with Mike, and he called me from Dubai at 3 a.m. because we had this very important person who was doing some filming, and they had a very narrow window of time. And I needed to know what his plan was so that I knew what my plan was. And as I told him, I was like, I know that it's important what you're doing, but I'm putting the scar in the middle of her face, and I need to know what the hell I'm doing.
Yeah, 100%.
So I know you're sleeping comfortably, but I'm stressed out. Like, I need to know what we're doing here. Because what you end up doing and what little angle you put on those little veneers is going to affect what I do on the lateral roll, what I do centrally. Because do I want things to come up like a curtain, or do I want it to roll like a carpet? Do I want the lateral side to roll more? Do I want it to pick it up? How do I want to do a little muscle suspension of the orbicularis so that when she's smiling, you can see a little bit more of the lateral incisor and canine? Or are you going to be dropping those teeth down so I don't have to worry about that? So those little tiny details, which for the average bear, they don't particularly care. They just want to have a pretty smile and they want to look good on camera. It's super important to all of us.
Yep.
And it's something that we think about and particularly discuss with them, because how that affects their occlusion. Yeah, your teeth might look good, but if every time you close your mouth, it feels foreign and strange to you, that may not be the right solution for you. And that's when you guys have to deal with those patients and tell them, listen, this isn't going to be a pop in, pop out, oil change, haircut kind of situation. We got to work with this and kind of get you teed up.
Now, kind of on that topic that conversation, when you have at least revision work, all of us do a lot, especially now, a lot more revision than I think dentistry might have used to been doing cosmetically. When you have that conversation, say someone comes in with like lips, and the lips, when they come in, you're like, okay, this is going to be, we really have to dial something back. It's pretty much a complete redo. When you're having that conversation, do you also consider look at the teeth, look at old veneers that maybe are part of the issue? Because we see that where we'll have somebody come in, huge lips, and then they say, well, now my teeth are dark. And it's not the teeth, but it's the shadow of the lips. So how do you approach the revision sort of conversation?
The answer I'm going to give you is very different today than it would have been 4 years ago.
Okay.
So 4 years ago, I would have said, screw the lips or screw the teeth. I'm just going to dissolve the lips, do whatever it is, and then kind of make do with what I have, just kind of try and make a silk purse out of whatever I got. The results were good, but not as good as I would have liked them to be.
Okay.
And part of that has to do with the dental issue. And so I think that now every single one of my patients, when we talk to them, particularly with revision work, primary revision, whatever it may be, is I always talk to them about tooth show. And so if someone comes in and they're talking to me about the proportions as we were talking about earlier, number one is, okay, what is it about it that you want to address? Because with lips, the thing that people have become enamored with is the idea of that person over there has a really short prolabium. The distance between their nose and their upper lip is super short. Ergo, I should have a really short distance. And then I will also be stunning and beautiful like them. And what I try to discuss with them is that facial skeletons are not, the same. And so often people will try to say like, well, I want to measure between 11 and 13 millimeters. And I'm like, that's great. and I want a matte black Ferrari 812. There's lots of things that we want.
Yeah.
But the truth of the matter is that may not work out for them, right? And it has to do with their facial skeleton more than anything else. So the teeth come into play now more than ever before. And when someone sits down in front of me and they're talking to me about revision work, I might tell them, okay, that's great, but you got these big old chiclets that they put in there because what your dentist was trying to do was give you tooth show, which they accomplished. But you guys have not been working in concert with each other. So you had one person doing one thing, one person doing another thing, both of them trying to achieve the same goal, but not working together. And so you ended up going in different directions. So we need to kind of circle back, get it together, and really get the right proportion, the right answer.
Yep.
And when that does happen, it's not uncommon for me to have these patients come in and I say, okay, well, this is what you're gonna do. You're gonna get your teeth fixed, get them right where you wanna be. Talk to your cosmetic dentist, let them know this is what you are planning on doing. Here's my number. Have them call me. We can discuss this in detail to figure out exactly what the best plan is.
Got it.
Because it's not uncommon for them to come in and be like, oh yeah, we had to change the entire frontal structure of their maxilla because it just was not appropriate for them. You know, they had done these crazy long veneers, which you guys probably see all the time, where they just looks like crazy chiclets, straight white all the way across.
Yep.
And if they had done something a little bit softer, a little bit more natural, maybe giving them a little bit more width so that the smile was a little bit better. And then when I come in, dissolve the lip, half the time I don't even have to do surgery. The structure itself just supports it. So you're fine.
That's what I find very common. And, you know, Vince, we trim implants similarly. And what we see, especially in dentistry, is that in cosmetics per se, is that people are just fixing teeth and they're not fixing the whole. So they look at a patient, they just want to put veneers everywhere. They don't take a look at the bite. They don't see how collapsed they are. And then they're just trying to work in an environment that is just not going to lead you to a path of success. So a lot of the times we work with that lower third to try to open it. And a lot of our patients, they're getting plastic surgery after. So we're getting that typical patient that is in their 50s and they're trying to just bring the clock back a little bit. And what I end up doing very often is opening the lower third. So making those lower teeth a little bit taller, giving you the upper teeth for the aesthetics, and then putting them in a place that now, if you're going to do any surgery at all, it's either going to be very small or less than what you were going to do before, or you have to play with different angles. The whole purpose is to do something the least invasive as possible. In my field, it's like that. In yours, I'm sure that you're more comfortable doing something more, something smaller than going and doing bigger surgery that is not needed.
Yeah, that's not necessary. And to your point and to kind of what Vince was bringing up earlier, I think that historically, even as early as 4 or 5 years ago, the idea of people knowing and understanding, even within our particular industries, right, that you can work together. I think that there was very much this territorial and even a little parochial way of thinking where it was like, this is my patient, I'm gonna fix this. When in reality, it's like, no, it's our patient. Correct. And if all of us do a tiny little thing, it amalgamates to a much bigger thing. Right. And I tell my patients, listen, this is going to be one of those things where it's not 1 + 1 = 2. This is 1 + 1 = 4. Like I do one little thing, they do one little thing. It's going to be that much better than if I do one bigger thing. And then that gets you halfway there. Like you're still going to be reaching for that next level.
So I have a question for you. So what are some of the most common procedures that you do as a plastic surgeon that the teeth can benefit your surgeries or directly related to?
So this is actually something that we were talking about earlier before the camera was rolling, is rhinoplasty, something that people don't talk about or don't think about, because how that lip sits is the most common complaint people have after rhinoplasty. Is they'll get a rhino and they'll say, my lips sit differently. My smile is different. And I'm like, yeah, well, you've changed the center of your face. So everything that you're focusing on is going to be a little bit different, So you have to be aware of that. So if I go into a rhinoplasty consult and I don't discuss with them their smile, I can promise you 9 times out of 10 after surgery, they will be talking to me about their smile because now you've brought to the forefront something that they weren't noticing before. And so I think that in my case, patients often come in with the blinders on where they're just so excited about, listen, I hate my nose. I've hated my nose since I was 12. I've always wanted to change it. I just want it out of here. It's not particularly a bad nose, but I get it. You know, they want to do a little tweak here and there. Come in, easy. Shave a little bit hump, narrow it, give it a little tip definition, rotate it, whatever. Easy. Looks great. 3 months later, I love my nose, but there's something about my smile is just not right. My face looks different. I'm like, okay, well, yeah, of course your face looks different. We changed your nose. And if you don't have that discussion before with them about, listen, your chin's a little bit pushed back. Your teeth, you constantly are straining to close your teeth. Your lips are straining when you close them together. When you're smiling, you're really exerting to elevate your upper lip. If you don't mention that to them beforehand, they sure as hell is going to notice afterwards. So I think rhinoplasty is one of the ones that most people don't think about. Lip lifts, obviously. I mean, it's that bread and butter. Need to talk about teeth. And facelifts. Facelifts are super important. Why are facelifts important? Because of that gonial angle that starts to resorb over time, right? So that mandibular angle, particularly with the Western aesthetic. My Asian patients, they could care less about this. They like that rounded V-line look. And I mean, you guys probably see it all the time. Korea. Exactly.
They're rounded.
Yeah. So it's totally different. But when you want that Western aesthetic, you like that chiseled jawline. And so I get those postmenopausal women that come in and they say, listen, this was my jawline 10 years ago. I'm like, beautiful. Love it. Amazing. Okay, I want that back. Can't have it.
Yeah.
Why can't I have it? It was just 10 years ago. I don't understand. And I'm like, let me take a look at your teeth. And like, they haven't taken care of anything. Molars are gone. Everything's out. And I'm like, okay. I'm like, so what'd you do? I'm like, oh, I had my teeth done. Okay, what'd you do? I, just had, the incisors on the front, bottom. And I'm like, okay.
The social.
Yeah, exactly.
Social.
They had social. They had social dental work done. I'm like, they're like, yeah, I had my teeth done. I'm like, but you didn't. And they're like, what do you mean you're not? I'm like, oh, you needed to do a little bit more because now that bone is resorbing. Like, why? Well, once you don't have the teeth there, that bone starts to resorb because you don't have the dental stock anymore and blah, 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 blah. All of a sudden that angle's gone. So now we have to augment with either fat or implant. Implants never look good once you start losing that bone, but you can do a little bit of fat. I like to do soft tissue flaps to kind of reconstruct that angle, but it's not the same. And so when you get someone who is in their 40s and you're doing a facelift on, which is becoming more and more in vogue, my discussion with them is not just about tissue elasticity. It's not just about volume. It's not just about hormones that they will have issues with once they go into menopause and they start having the skin issues, bone issues, hair issues, whatever. It's about dental. Because if they are not taking care of their teeth, they are going to see that loss of that mandibular angle. They're going to start seeing a little bit of the bone loss along the mandible as well. And then what happens is the pre-jowls start to show a little bit. You get a little bit of that laxity here when you're taking that picture from the side. And that's what people notice, but they don't realize that the underlying reason why that's happening is bone.
Exactly. And sometimes, a lot of times it's the teeth, and sometimes it's not just the fact that the patient have not taken care of the teeth. That's 90% of them, but it's also as we age, our teeth are going to change, just like the rest of our body. So a lot of, a patient above 40 something, 50 years old, in general, they are pretty ground down, especially in the back. So their teeth used to be this height. Now they have decreased in size. And then that has made the lips drop a little bit more, the nose drop a little bit more.
You get that square face.
Exactly. You get that square face look, and then they want bigger teeth. That's what they want. They want to have bigger teeth. And sadly, I cannot make the teeth bigger unless I change the environment, because everything is about the bite. It's about how you talk, the movements that you do. It's about when you eat, the movements that you do. And you have to create the new smile in accordance to that. So a lot of the times when we restore the lost tooth structure, we end up being, number one, more conservative. That's what patients don't understand. We're talking about when opening the bite, like a lot of patients freak out because they're like, oh my God, I got to do 14 teeth now instead of just doing the 10. But when you're in a collapse environment, I have to grind down your teeth to make it so the veneers can fit in that environment. Now, when I open the bite, all I'm doing is adding porcelain to the teeth. So I'm not really touching your tooth. So it becomes a less invasive treatment that gives you that facial aesthetic outcome that a lot of patients want. And it's not just about the teeth. Like most of these big cases, when they come back, people are just like, you look 10 years younger. Like, what do you do? And it's not just the teeth. It's the fact that you restore this lower third.
Yeah, I think that, we all kind of have the same goal or similar goal where you want to have the patient have the response when they go to their peers where you're always keeping them guessing, right? Like everybody's always like, what did you do?
Did you have done?
You want to have people say, I tell everybody, I'm like, this is what we shoot for. We shoot for the keep them guessing.
Yeah.
When you're keeping people guessing, that's exactly
The best compliments when they don't see it right away.
Yeah.
It's a subtle thing. Doc, for the dental listeners out there, what are some communications or things they could look at when they do final photography or when they're planning a case, for example, and they have lip discrepancies? There's many times where I'm looking at a patient, you see their smile line and their lip will droop or it'll be raised, and it could change the way that you position the teeth at the end for aesthetics. What are some communications that they could be having with a fellow facial plastic surgeon that they work with in order to get that case to perfection, in order to get that patient that perfect smile?
I think the most important thing is making sure you have an open line of communication from the get-go, not just between the two practitioners, but also with the patient. Because more often than not, I'll see something, my colleague will see something, patient has no clue what we're talking about. And then all of a sudden we're chasing something that we like. And it's something that the patient never even thought about. Sometimes it works out and they look better, but sometimes they don't really notice much of a difference. And they're just kind of sitting there like, okay, that's great, but I didn't really ask for most of this.
Okay.
And so I think when looking at the lower third, you actually have to not just focus on that area from a soft tissue standpoint, you also have to focus on the middle third too, because that volume loss in the malar area and that descent, once the zygomaticus starts stretching a little bit and those muscles kind of start coming down, you start getting a little bit more of that corner coming down. The DAO is pretty stuck there. You're not going to be able to snip it. Even in the best case scenario, you look at all the literature, there's a 50% success rate with DAO release. So it's a good adjunct. But in and of itself is not going to be that powerful as we once thought. And so looking at that entire structure from a soft tissue standpoint, I need to know what the end point is going to be. Because I've had patients that went in for simple dental work, thinking they just wanted to fix their smile a little bit. They get sent to me, thinking that they just need a corner lift, or they just need like a DAO release, V to Y to the lower lip, lip lift, just full rehab of the muscle work down below. They just need a facelift.
I'd like to touch on something. Dental can't. Sometimes we see this in dentistry, and it does affect the way that we go about our treatment plan and the way that the teeth are going to look. So we have to modify that. At what point, and I'm sure with your experience you've dealt with this, at what point do you chase an asymmetry like that versus mask it?
So that is where the communication comes in hand, because there are limits to the asymmetry that you can address. Because particularly when you have significant dental canth issues, guess what? It's not just an asymmetry in the maxilla or the mandible. That's going to permeate across the entire facial skeleton. So more often than not, one orbit is going to be bigger than the other. One cheekbone is going to be lower than the other. The other one's going to be a little bit more projected, a little bit more. So if you're just chasing the dental canth symmetry, all of a sudden you're going to have this perfectly straight smile and the eyes are going to be a little wonky off. And most people don't notice. Everybody's got a little bit of an asymmetry.
And even they'll have some hypertrophy of the ramus too, where one side will be bigger than the other.
Yeah, 100%. And so it gets a little finicky. So I always tell patients, it's never going to be perfect, but it's going to be a lot better. And it's interesting that you bring that up. I had a facelift on Friday, and when she listens to this, she'll know who she is. But so we did a facelift, a little bit of nano fat around her eyes, a little bit of laser under her eyes. And we had done some work before, and it was just a touch up. Super pretty girl, Scandinavian descent, time machine surgery. Like picked up one side, you're like, oh, she's gonna look amazing. Pick up the other side, oh, she's gonna look amazing. I did a platysmoplasty across the bottom, submandibular gland resection, laryngeal setbacks, really getting her that like swan neck, super defined, really pretty. I'm closing up and I see that at this point, you've kind of been 4 hours in surgery, you're just honing in on one specific spot, right? And I'm looking at the contours and I see that it's just a little bit fuller in the left submentum. And I'm like, what is going on? I'm like, I just looked there. It was perfectly smooth, looked great. Lift up the skin. I hadn't sutured it up yet, but drains are in. It was just like the last little bit. Cleaning off the soft tissue, cleaning up. And I'm just like, what's going on? And then I take a step back and look. her ramus no longer.
Skeletal.
So she's got some skeletal issues, and now that everything's so tight and snug, and I'm so focused on like I want this to be this perfectly contoured neck with insane shadowing underneath, and just get her super super tight. I'm noticing it, and I'm like, oh, why am I stressing about this? Then I take the step back, take a look at the full face, and I'm like, no, this is just how she is. This is the bone, and this is the soft tissue. We're good. Close up. And so it's one of those things where when you take the step back and you look at the full patient, don't notice it, but you can get hyper focused.
That's the facial harmony aspect of it, rather than
100%.
chasing perfection, which you can't do on someone. It's impossible.
No, and the thing is, like, unfortunately, as you guys all know, you do get that like 1 or 2 random patient every 3 or 4 months where you're like, damn, you're symmetric. Like, this is
Makes it
crazy.
easy.
Yeah.
Like, yeah, this is really easy. Like, wow. Like, this is
And that's the beauty of all cosmetic work. Like, I don't try to chase perfection. I try to create something that is beautiful within, the patient's face. And we're not perfectly symmetrical.
that's the thing that's hard to describe to people.
And it is hard to describe.
that's the
But
thing that's
a lot
hard
of
to
the time,
describe.
that's where I spent a lot of my time. Is like, I'm going to make, so like I had a patient the other day that her midline was off like a millimeter or 2. Then I end up doing her teeth and it looked wonderful. But now she's like, she's like, my midline's off. I'm like, midline has always been off. And I show her pictures. She's like, oh, wow, I'm noticing it now because now I'm like really close trying to take a look. And I'm like, once the veneers are, everything is in, like, it's going to look beautiful once everything heals. But right now you're seeing your papilla way up here. You're seeing the midline, like you're getting a little confused. Yeah. And that's a conversation that,
And patients will get that with noses, right? So like a rhinoplasty, like if their tip of their nose points to the left or points to the right, but yet we're planning for straight middle of their face. Patient be like, but that's not, my midline's not there. I'm like, it is. You need to see a facial plastic surgeon to put your nose into the right spot now.
Right.
Because, you're looking at your nose way more.
Yeah, the whole facial harmony aspect of it, I find fascinating. And it's really hard to describe. And, I tell people that this is, I actually, there was, I forget where I heard it from, but it was a story about Walt Disney when he was coming up with the Pirates of the Caribbean ride. And I mean, this is 60s, right? And so he had these Imagineers coming up with all this crazy stuff. They come up to him, they're like, Walt, yo, we got these birds, they look perfect. He looked at them, he said, they're not good. What do you mean they're not good? Like, they look exactly like a bird. He goes, but they're not breathing. And he goes, what do you mean breathing? It's inside, it's a machine. And Walt Disney looked at them and said, he's like, but when people look at it, their heart will know that that is not a bird. And so it's that thing, that concept of, it's hard to describe, but when you see it,
Visual tension.
Like, you just know. Like, there's just, like, things are off until they're not. And then there's like that 1 second when you're like, oh, I don't know what I just did, but it's good now, we're good. And they'll ask you, well, what did you do? I don't know. I was just fucking with it. And then like,
we got it.
We got it. Looks good. Looks perfect. Can you re-go over that? No, not really. I mean, I was just kind of fidgeting with this and it just fell in the spot that now it's good. It's perfect.
That's how it is. And that's what I tell a lot of patients. Whenever you're designing a smile, it's about making it flow. Like this past couple of weeks, I've gotten 2 cases that have been, I like to call them perfectly imperfect. Because it's this patient that she wanted to get some veneer work, that she had 2 veneers, a canine and lateral on both sides, and she looks off. Because what I told her is like, they made these veneers like perfect laterals and perfect canines, but the rest of your smile is not perfect. So that's when you put something perfect in an imperfect environment, and now you get all this distraction. Every time I look at her, all I see are those teeth. So I said, we're gonna replace those veneers, but I'm gonna make them look natural. So you're not gonna be perfect. You just, so you know, the teeth are not gonna follow what a normal, they're gonna follow what your other teeth look like. And then another guy, the same thing. The centrals, I made them crooked. I made a little dent on one of them. And then when you look at the smile, now it flows and there's no really distraction to the eye.
Yeah,
So.
and that affects compounds. Absolutely. It's one of those things where, I mean, particularly with you guys deal with it more than I do. Smile's off, teeth are off, people notice.
Yeah, you notice.
Right away.
Dr. Mascaro, I wanted to say thank you for including dentists in your conversation, because I feel like as dentists, we're on like an island. It's like, okay, you deal with teeth and just teeth. But like, as you said, with the curtains and the actors, if the actors aren't in the proper position, they can't support the smile and the teeth. My question is to you, what happened 4 years ago that, made you pivot or made you...
I think it's just, so in my training, we did a lot of combined work. We did a lot of combined orthodontic work with cosmetic. And at the place I trained at in Alabama, there were some legitimate orthodontic wizards that spoiled me and made me think that, oh, double jaw surgery is a 2-hour surgery, that they don't need wiring and it's super easy and everything looks great and they don't get much swelling. When in reality, that's just wizard. That's just witchcraft. Like they are just straight sorcerers, you know? And then once you're in practice and you try and find that and you realize that like, oh, turns out not everybody can do that.
Exactly.
You know, you kind of start pulling back a little bit and then you realize, wait a second. The results that we're getting now are not nearly as good as the results that we were seeing then. Is it me? And then you realize like, wait, no, it's because I'm not including other people as part of that treatment plan.
Interesting.
And the big shift that happened, I think, was when COVID happened. People got a chance to sit at home, look at themselves, and not only that, but allowed for this type of forum to happen much more readily, where people were like, let me talk to my colleagues and just have open dialogue about stuff. And rather than kind of honing in and saying, oh, this is all we do, this is all we do. You know, I saw this guy talking about this with somebody else. Why don't I bring somebody like that into my practice? And I remember when I first started practicing in 2015 down here, like I reached out to every dentist in South Florida that I could find. I got one response back from them. And the idea of some of the, because they thought I would be stealing their patients, you know, and I'm not stealing anybody. I'm like, yeah, I just,
You're trying to help.
thing, man. I'm trying to make the best thing for the patient. Yeah. And then over the last couple years, then the idea of collaborative work has just skyrocketed, you know? So now, and I mean, part of it is I do so much lip work too. So people reach out to me a lot, but it's no longer this idea of, oh no, we would never work with them. They start seeing the benefit because now even in conferences for cosmetic dentistry, for cosmetic plastic surgery, people often talk about the bony skeleton and the bony work. And when people talk about bone, the thing they forget about is that's what the teeth are. And they're so important because if you don't take care of them early on, you will see that aging hit you faster, hit you harder earlier in your life. And if you have colleagues that can kind of guide patients through that process early on, rather than them thinking, as we were talking about, the social veneers, where they're like, oh, I'm just getting, you know, 4 uppers, 4 lowers. I just want to look kind of cute when I take pictures. Then you really see the benefit of it because now you're establishing a long-lasting patient. And then you start seeing that the same way that we have relationships with patients that are 10, 20, 30 years, you guys have relationships with your patients that become 10, 20, 30 years. And I think that historically, it used to be, you come to my office, I do rhinoplasty, you leave, maybe I see you, maybe I don't in 10, 20 years when you need to do a facelift, maybe, hopefully. Whereas now, they come in, we're doing little tweaks, we're doing little things here and there, we're in communication. Hey, I saw so-and-so. Oh, you went to see your dentist. Excellent. What are you guys doing over there? Perfect, we're doing this. We're gonna hold off on your filler because when they do that, that's gonna help out with the position of your lip. Oh, okay, great. I don't need to do that. And so now all of a sudden, they become part of the family, right? And so you start really doing a full 360 integrative care rather than just, you come in, you do this, you go there, you do that. So even though it's highly, highly specialized, when you go to your office in Delray or you're in Brickell or you come to me, it's still everybody working together. And so I think that patients have realized that there is a benefit in seeing someone who's highly specialized, but there's that extra added benefit in seeing someone who's highly specialized enough to understand that they need assistance and help to make sure that the best outcome happens.
Correct. You're not going to achieve a great outcome just by doing one specialty. No. It's better when you combine it all.
Less of an investment when it's done right the first time, right?
Correct.
100%.
Cheaper.
Yeah.
So if you have, you know, the proper clinicians, physicians in one room and you say, okay, the nose is canted to the right, your teeth are canted to the left, and your eyes are not on set, well, we need a comprehensive approach. You need to see your plastic surgeon and you need to see your dentist. And it is going to be a big investment, but you're going to get it done once. it's going to look phenomenal.
Yeah, so for patients, I think that if you have this in mind, that you're going to get multiple surgeries, I think it's good that you let each individual know what you're getting done, what your goals are, so that they can communicate amongst each other to come up with the best plan. Because sometimes, sometimes it could be a tooth thing and I can see it, but then if I'm going to move the midline and then you're going to move the nose, then I'm going to throw you off.
Yeah.
So if you let me know what you're doing, maybe we just meet in the middle, So that way, the whole thing is about creating balance.
Yeah, no, 100%. It's so true. And you see it in rhinoplasty, you see it in facelifts, you see it every time I line them up. First thing I do, make a line down the middle of the chin, and then I tell them, hey, listen, your chin's slightly off center compared to this. That's normal, but the reason I point it out is because I'm gonna put a 2-finger breadth incision under your chin, and then I don't want you to freak out and say that it's off center. It's not. It's just lining up with your natural anatomy. And if you don't have simple discussions like that, then forget it.
I have a question for you. Sorry. What are some of and this is more for listeners, what are some of the ages where you find more common to do certain amount of surgery? Because now with fillers, we see that most people, and are leaning towards, I just want to fix it all with fillers. And as we know, that can work in some cases, in some ages, but not in other ages, because you end up overfilling this patient. So what are some of the ages where you're going to tell a patient, look, it's better if you do this type of surgery versus doing fillers versus so that they get an idea?
Yeah, I think it's very individual. I think that the paradigm has shifted a little bit now, right? Where we're seeing younger and younger people doing more and more aggressive things. Whether that's good or not, it's very individual. I mean, everybody knows somebody who is their age that looks like shit. And you're like, yeah, you probably needed a little bit more aggressive surgery. And then, you need more. But then there's also patients who are much older that look incredible, right? And so they probably don't need nearly as much or nearly as aggressive of intervention. Now, the fillers are interesting because people think of it as a quick fix. Fillers inflate, fillers don't lift, right? We have to remember that. Even in those fillers that have a high G prime or they're really thick and they're supposed to lift, it's still jelly, right? That's all it is. It's just thicker jelly. It's not as it's some magical cement that's going to create bone and really lift and elevate the tissues and get those ligaments and really retighten them up. So you have to think about what is it exactly that you're doing. And this harpens back to the point that we were just talking about where the cheapest stuff ends up being the most expensive in the long run. And so if you just think like, hey, listen, I'm just going to go and I'm going to plump myself up with a ton of filler because this is what's going to make me look younger, what ends up happening? 9 times out of 10, those people end up dissolving their filler because it looks funky, looks weird. And then what happens? They look better. They look better without as much filler. And so I think that we're starting to see a little bit more of that conservative angle with the filler where people are starting to see a little bit of that filler fatigue sooner and they're more aware of it. So rather than trying fixing it with more filler, they're saying, maybe I've been doing too much. Let's slow down. From a surgical standpoint, it depends on what. Rhinoplasty, obviously, everyone from like a 15-year-old girl to like a 70-year-old wants a rhinoplasty. I tend to not like to do rhinoplasties on people who are over the age of like 50, let's say, unless there's trauma involved, right? I mean, that's the asterisk. My rationale behind it is you've got a lifetime of pictures with a certain nose. You've got memories, you've got weddings, you've got graduations, you've got kids' birthdays. All of a sudden, you're going to change how your face looks. It's going to affect not just you, but the people around you more than anything. And it may not be the right thing to do because you think that it's going to be this cute little button nose, but that's not your tissue anymore. It's not the same structure. You're changing your face in a very dramatic way. So I always kind of really caution them and tell them, hey, listen, we go over the imaging very detailed to make sure that it's attainable and that it makes sense before you do it. But then from a very aggressive standpoint, right, you're looking at facelifts, that sort of thing is now we're seeing it in younger patients. People in mid-30s are getting facelifts. And it depends. There's different types of facelifts. Some people don't need it as much as others. You're really doing tweaks. I think that we see a lot more of that, particularly with the younger, very pretty patient who it depends on, a little bit of money and their looks as far as like how they make their money. And in that regard, I think of it almost as a business investment for them. And they'll tell me, I have plenty of young patients that come in, they're guest models, they're signed to big agencies, and they'll say, hey, listen, I just need a little tweak. I just need for another 3-4 years. I just got to do this for 3-4 years. I'm engaged. I'm going to have my kids. Like, I know I'm going to care later on, but this is like the last tail end of when I can really make some money. I'll be good. And so for them, you're catering. You're not doing nearly like extended deep plane facelift, submandibular gland resection, platism. Like, you're not doing that. You tweak, right? And that's where things get a little different without getting too far in the weeds, because I'm rambling a little bit. But it's you can cater it a little bit. Lips is where things get interesting because fillers can only do so much. It's jelly. And what I find is most people, what they really want is they want to change the architecture of their lip more so than actually fill their lip. And I think the greatest lie that was ever sold was that a little bit of jelly can change the architecture of your lip, can change the shape of your lip, and not just hydrate or inflate, right? And so what I tell them is, listen, you're not gonna change the proportions, you're not gonna lift your lip, you're not gonna shorten your lip, you're not gonna do any of those things by adding jelly to anything that's just hanging off the bone. You just have a hanging curtain and you're adding weight to the bottom.
Correct.
That's all you're doing. So yes, there are different types of fillers that can achieve different types of things, but depends on what you want. And so that's where modern lip lifting techniques come into play. So, I'll have a 23, 24-year-old girl that wants a lip lift. People will tell me that's crazy. And I'm like, okay, well, is it that crazy? Because she's got no tooth show. She needs to have her teeth done to get a little bit improvement on the tooth show. Her lip does not fit the architecture of the width of the mouth compared to the width of the nose, right? Things are off. And so if we just change things by a few millimeters, guess what? We're going to be cranking this up and she's going to look incredible. Nobody's going to know. And that's the goal. So it varies, man. I mean, we see it everywhere. I think that the super young patient, like the 17, 18-year-old, I see some. I hate it when their parents come with them, because obviously anybody under 18, you need to have their parents with them, and they'll come in and their parents are like, oh yeah, they want filler. And I'm like, yeah, but they're 17. They're 16. Like, they're in high school. Like, what are you doing? Like, no, go home.
Yeah.
And just in general, if you're gonna do fillers, please, and you're gonna do the teeth, do the teeth first and then the filler. I had a patient that she's in temporaries. Imagine, I made all my plans based on how your lips were today. She comes back for insert with her lips huge. And I'm like, what did you do? She's like, oh, I want to do my lips. I want to do my teeth, everything at the same time. I'm like, you just completely went against everything, because you make your plans to something and now you create these big lips that weigh 100 pounds and you're just coming down. Now when you smile, you don't see your teeth. So always keep us involved.
When you increase that thickness of the upper lip, for example, with filler, that affects another component that we actually didn't touch on, gingival excess, for example. As cosmetic dentists, we are trained to also take that into consideration, where the gingiva lies, and that can affect what is showing, what is displaying, the amount of teeth display. So I'm curious on your opinion, at what point do you consider a non-surgical route to be more beneficial in conjunction with, for example, a gum contouring procedure, lengthening to show more tooth display, and then lower that lip? Because we see high smile lines very frequently, and a very common thing that dentists will offer is some Botox. So I'm just curious, when is that middle line, for you, considering non-surgical versus surgical?
I think it happens all the time, especially when I'm looking at these patients with smiles. Because when I'm talking to them about lips, so my cheesy consult, looking behind the curtain for everybody out there, and they'll catch on to my shtick. But the first 5 minutes of my consult with someone is literally me just bullshitting with them. It's just joking around, talking, blah, blah, blah. But what I'm doing is I'm watching how your face moves. I'm watching how you smile. I'm watching how you joke, how your lips naturally move. I'm trying to get you to laugh. I'm throwing everything I can out there to try and get you smiling, right? Because I want to see how, when your guard is down, when you're hanging out with family, when you're hanging out with friends, I want to see how things move. And so I'll have patients that come in, and you guys see them all the time too, where at rest, if you just saw a picture of them, super long prolabium, right? The lip is really long, everything. You're talking to them, they start smiling, got these tiny little teeth, ton of gingiva, right? And so you're like, okay, soft tissue, I see what you're concerned about. I agree, it looks crazy long. Solution's not a lip lift. right? The solution is not a lip lift. This would be the worst thing that could ever happen to you. And so I tell them, I'm like, listen, I agree it's long, but if I did a lip lift, we're taking like a millimeter and a half. And at that point, I tell everybody, anything under 3 millimeters, it's not going to give you any sort of appreciable result, number one. Number two, I'm putting a scar on a pretty face. Why? Number three, every scar needs to be worth it. I tell them, I'm pretty good. I can get you a pencil thin line that's hard to see. But guess what? Genetics come into play. Some people scar. If I had a lip lift and Jesus Christ came down and sutured me up, guess what? I'm gonna have a nasty scar because that's just what happens with me. Like that's just what happens. So you need to be aware of that too. And so in those cases, the first thing is like, listen, you do not need a lip lift. Lips are fine, proportions okay. I get it, but we cannot have this discussion until you address your teeth and how much gum show you have. And so more often than not, they'll go see a dentist, do a little gum surgery, they'll get a little bit more tooth show from that end. And then once that's there, little Botox. It flips their lip up, they're good to go. And I'm just like, okay, that's it. You just needed 8 units of Botox and a little gingival surgery, as opposed to doing a lip lift, going through the recovery process, minimal lip lift at that. Then you're upset because the lip really doesn't look that different. But in my mind, I'm keeping you from looking horrible, right? And there are some times when, you say, okay, you want to go super high, let's go super high. And some people are happy and others aren't, And so, sometimes, you guys have this too, where there are some patients that'll come in and they ask you, they're like, I need to have this particular look. And you're like, it doesn't look good. And I'm like, no, this is what I want. I'm like, are you sure? And like, yeah, you video them. They're holding a newspaper. There's like no gun to their head. They're like, yeah, this is what I want. This is my vision board. This is what I want. You do it for them, and 9 times out of 10, they're ecstatic. And you're looking at it, and you're like, I don't know. Okay, whatever, you do you. But that 1 time out of 10, when you're like, man, I should have listened to myself. Like I knew all along. They really just needed a little bit, done something else, would have been fine.
On that topic, where people come in and they're like, this is what I want. How much have you seen social media play into that? We get people all the time. I want these teeth. And they'll show us an old case, and you're like, I can use a little bit of the shapes, but like that's going to look crazy in your mouth. So I assume it's similar.
We probably do very similar stuff when it comes to that. Mm-hmm. And I tell everybody, I'm kind of like your interior designer. Okay, so you get me a bunch of kitchens. I take a look at it. I look at your kitchen, and then I say, okay, we can't do that, but I see what your aesthetic likes.
Yeah.
And so I try to frame the conversation around I use your inspo pictures to see what it is that you like. So when I ask for inspo pics, I always tell them, I want you to bring me a white girl, an Asian girl, black girl, Hispanic girl, all sorts of different people. I want to see what you find pretty, because then that gives me an idea of what it is that your brain finds attractive. And then I can kind of work with that. So I can say, listen, I can't get you that, but I can do a little bit of this and a little bit of that. And then we can get that.
But it's like,
it works very, very well.
It's very nice.
The ones that worry me are the ones that bring the exact same person. And that's where social media comes in.
Yeah.
Where someone will come in and they're like, I want this. And I'm just like, you're just in love with that person. Like you're obsessed. Yeah. You're obsessed. And I get it. They're beautiful. I get it. Listen, I get it. Stunning. Not you. Okay? Like I get it. But it's not her lips. That's not what you like. You just like how that person looks.
Yep.
Good point. And very briefly before we close for today, I'm curious on how you obtain your record keeping and your measurements for a lip lift procedure.
So I do everything supine. So I do things a little bit differently. I think that the biggest issue that people have is people chase numbers and they don't know how they're measuring. And so I tell everybody this is as the crow flies, meaning I don't push on the lip, because when you push on the lip, it's going to stretch it out. It's going to make it feel like it's longer. So I use calipers. I go from subnasal to the cupid bow. Very simple. I use that as my main measurement. And then after that, we go to the foot plate, and from the foot plate, just lateral to the cupid bow. So just to the apex. And that gives me an idea what to do. I always measure supine. Why? Because anatomically, all the measurements in anatomical textbooks are when you're laying down. So I do it when you're laying down. And I tell everybody, I'm like, if you were to do this, you legitimately are shortening about a millimeter and a half. Like if I measure you when you're sitting up and it's let's just for funsies, it's a 20 millimeter lip. When you lay down, it's an 18 and a half millimeter lip. And so it's hard sometimes for people to see that concept and to rationalize.
Is there a magic number? I have to ask.
So people love that 11
I
to
mean,
13
we have
number.
golden proportions in dentistry.
Yeah.
I'm just curious,
Yeah.
is
No, I
there
get it.
that
Yeah.
golden number? That,
Yeah, people love that like 10 to 13, like around 11, like around 11. But I tell them that it varies so much on their facial skeleton, right? So if you've got someone from Norway or Scandinavia and they've got this really oblong facial skeleton, guess what? Like they've got 17 and 18 millimeter lips and they've got amazing tooth show, right? Like it's perfect. It just fits them. Also, the labiomental distance is much longer, right? So you compare that with someone who's coming from the Philippines, for example, and they've got that really short face, wide cheeks. You can lift their lip up to kingdom come, you won't see teeth, right? Because their maxilla is so short. So it varies a little bit, but I would tell you for the average Western bear, probably you're floating anywhere between 10 and 16 will be fine, which is a fair distance. But that being said, I have patients that have 6 millimeter lips, perfect, like
I
stunning.
think the numbers are good to follow, but it's never like a hard
Just
rule.
numbers.
I don't think I have.
They're just
enough
numbers.
to get
Because
a
we,
lip.
I mean, in the dental world, we're
like all
all
those
like most dentists. They want a cookbook. They want to know a number. They want to follow that number.
Life would be so easy.
And I tell
Yeah,
people
it's
like,
not-
stop, get out of
it's not
that
cookie cutter.
mentality,
Yeah.
and for one, just step back and take a look and see if you made that person look normal with that amount of teeth. Then measure it and see like if you're way off or whatever. But the most important thing is just looking at the patient and seeing what works on that patient.
It's funny. I mean, I have so many patients that chase numbers. I mean, I remember this was like 7 or 8 years ago. I did a lip lift on this woman in LA, measured 19 and a half. Just looked great, perfect, shorten it up. She comes in, do a video follow-up. About a year later, she's like, oh, it's fallen, it's dropped. And I'm like, there's no such thing as falling. You're cutting skin. There's elasticity issues. I can't control for those. You can't control for those. That's just genetics. Blame mom and dad, but let me take a look. She's like, oh, I want to shorten up. And I'm looking at her when she's talking, smiling. I'm like, we could come up a little bit more. And she was coming for a facelift. And when you do a facelift, you actually come up about a millimeter and a half anyway, because you're shortening the distance up here, and that elevates the whole swing, right? That's how I describe it. If you think of the lip as a swing, you're picking up the chains from the side. So it's picking up that swing a little bit. I'm like, hey, we'll take a look, see. So she comes in, started 19 and a half, sits down, and she's like, oh, what's my measurement? I must be at like 16 or 17. And I'm just like,
Red flag.
yeah. Red flag. And I sit there and I'm like, do you remember what you left at? She's like, yeah, I left at 11 and a half. And I was like, you're at 12. And she's like, really? And I'm like, I don't want you to think I'm bullshitting you. Here's a mirror, putting the caliper, 12 millimeters, here you go. You see that? And she goes, oh yeah, it's a 12. That's crazy, huh?
And then she Amazon Prime calibers.
They're gonna buy calibers online now.
Yeah. And she's like, oh. And so it's just like, listen. And then immediately they have that realization. I'm like, you think that 0.5 millimeter is really
Gonna show.
gonna change? I'm like, I want you to go to a ruler and see what 0.5 millimeter is. It's not. Like, you're fine. Like you look good. Thing is, your brain is now recognizing itself. So when your brain recognizes the face, those insecurities that you had in the past are going to peak back up again. And the devil that sits between your ears is your worst enemy. So you just have to remember that.
Yep.
So your office is located in Delray, correct? So
Delray Beach,
listeners
Florida.
know.
2 blocks away from the beach.
We got to
Really
come
nice.
visit. I want to check it out.
Yeah.
We'd love
Pop in,
it.
pop in.
Definitely got to come.
And what's your wait time right now? If a patient wants to come in, tell us.
Oh,
So next available consult is December 2025.
All right.
Next,
get all the way. That's awesome.
we're booking surgery in June of 25.
Congratulations. That's amazing, brother.
Amazing.
So
It's a great problem to have.
Yeah, champagne problems.
And,
It's embarrassing. It's embarrassing.
and Doc, what's your Instagram for all those? And we'll put a link on the in the description as well.
Yeah, easiest way to follow me is at Dr. Mascaro. So DrMascaro, not Dr. Mascaro. That's a band in Catalunya. My cousins. It's different. I'm related to them, but we're not the same.
Interesting.
Thank you so much for
Yes,
coming.
thank you.
That was awesome.
Amazing
Thank you,
talk, a lot of insights, and I hope this was helpful for everyone in seeing the harmony between facial aesthetics, plastic surgery, and cosmetic dentistry. We'll see you next time.
See you next time.
Awesome.